Hi, I'm Donna Dowell, board-certified family nurse practitioner and part of a growing number of healthcare professionals in New Mexico in support of the New Mexico Health Security Plan, a plan that will ensure comprehensive, quality healthcare coverage for New Mexicans. Healthcare under our current system is challenging for many. This short video is part of a series that features the personal healthcare stories of real New Mexicans, stories you will recognize as all too common.
My name is Joseph Duran. I'm a special ed science teacher here at Washington Middle School. The reason I'm doing this is because I was asked to share my stories about, not being insured, and there was plenty of times that in my life with a young family and a wife, we didn't have insurance, and it's very stressful, hard on everybody. And then when something happens, you get charged and you have a huge payment, and it happens several times. One of those times I was working nights, was on my way home with a friend. We decided to stop and eat at the Village Inn, and I pulled into a parking lot and pulled into the parking space. And as we're walking in, somebody starts yelling at me that I took their parking space. And I turned around. Are you talking to me? And I didn't think anything of it. I said, I got there before you. We went in, we ate, we came out, and there were 6 of them out there. And he was really mad and angry. And I told him, I said, I'm sorry, but we're just trying to leave. And I leaned in and he stabbed me in the neck with a beer bottle. And, I didn't know I was stabbed. So we fought. I put him down, and I hurt him. And at that time, my friend that was with me was yelling at me. And I said, "What?" And he told me, "He stabbed you." And I looked down, and there was blood. My whole shirt in the front was blood all the way down to the bottom. I couldn't believe it. I was like, "That's my blood." And then I walked over and looked into a car, and it was squirting out of my neck. And I told my friend, "He killed me." So I got in my car and I get back out onto the street, and I'm heading down south on San Mateo by Montgomery. And I ran the red light at Academy. So naturally there was a county sheriff, and he, pinches me towards the curb, and he comes out and he walks up to my car and he says, "Hey, what's the deal with that?" God dang, and I was like, I'm bleeding out. And I said, "I'm just trying to make it to that hospital." And he's like, "We're getting you an ambulance right now." And so when the ambulance got there, I was already out of my car, and they said, come here, get in here." And I said, "No, treat me on the sidewalk." And they're stunned. They're like, "What?" And I said, "Treat me on the sidewalk." And they said, "Why?" I said, "Because it cost me $750 to step into that ambulance, and I don't have insurance." I said, and I can't pay for that. And I know I can't. And then it'll be a huge bill. And we had this argument, and then they treated me on the sidewalk. I drove myself to the hospital, went in there. They couldn't believe that he didn't cut my carotid artery. And the whole time I was thinking, okay, but I just wanted you to treat me on the sidewalk, because I know the minute I come into this hospital, I'm going to get more bills. I'm going to incur more medical bills that I can't pay. And when you don't have insurance, you think about things like that, even when your life is on the line. Because I was afraid that if I died, bills were going to go to my wife, and she can't pay it either. We went like that for quite a long time, and then this happened, and it was a substantial, a bill for just that little bit of time that I was in there. But I managed to get 750 taken off by not going into the ambulance. And now that I'm a teacher, I've been fortunate for the last 10 years now to have insurance, and good insurance. Our son, on the other hand, he doesn't. It's bittersweet if our family is not taken care of in the whole aspect of it. So I feel good that I have insurance, and my wife and I are covered. But then, I worry about my son. If there's a way that we can make sure that people have insurance, I'm all for it. Thank you.
Joseph's story. Joseph, like 44 million Americans, had no health insurance for most of his young family's growing years. Joseph's family, like many, faced each day without the security of knowing that if and when they need it, medical care is available to them. Without insurance, individuals and families are extremely vulnerable. They're at risk of not getting regular care when they need it, not catching real problems before they get serious, or not getting the best treatment when they do fall ill or injured. And they're at tremendous financial risk. They could lose everything that they've saved in their lives because of some even minor, uncomplicated health problem. The Health Security Plan ensures quality, comprehensive, affordable medical coverage for New Mexicans. Joseph's plea to treat me on the sidewalk and his driving himself to the hospital are very sad commentaries on our current healthcare system. Delaying care for fear of medical bills is a downward spiral that leads to ultimately higher healthcare costs for all of us. A 2020 fiscal analysis, as well as 2 previous studies of the Health Security Plan, showed a slower rise in total healthcare costs over time and billions in savings for all. The New Mexico Health Security Plan ensures comprehensive, quality healthcare coverage for New Mexicans, regardless of income, health status, or employment, provides choice of providers and hospitals, coverage extending across state lines without network restrictions. How can you help? Become informed at newmexicohealthsecurity.org. Sign up for campaign alerts or donate to the campaign. Contact your New Mexico state representatives at nmlegis.gov. That's nmlegis.gov. Tell them to vote for the New Mexico Health Security Plan. Tell your own healthcare story at newmexicohealthstories.com. Contact us at nmhealthstories@gmail.com. Spread the word. Forward this to your New Mexico family, friends, colleagues, and neighbors. And thank you so very much.